COVID-19 cases continue to surge around the globe. The Department of Health has reported 15,046 new coronavirus cases and 416 COVID-19 related deaths in the past 24 hours. South Africa has recorded 1,246,643 infections since the start of the pandemic and over 33,579 fatalities. President Cyril Ramaphosa announced yesterday that South Africa has an aggressive plan in place to achieve herd immunity through vaccination and that about 20 million doses have already been secured. We're joined now by Professor Gregory Hussey of the Vaccines for Africa Initiative at the Institute of Diseases and Molecular Medicine at UCT. Thank you so much for joining us. A very good evening to you, Professor.
Good evening to you and to your viewers, and thanks for having me on your program.
So there's been a clamour for vaccination now, but the question is, will it stem the number of infections and deaths once received?
Well, certainly, I think the only solution to our crisis that not only South Africa is facing, but the rest of the world, is the availability of a safe and effective vaccine. And over the last few months, a number of vaccines have emerged showing excellent efficacy, as well as vaccines that are extremely safe to be used in the wider population.
Let's talk about that wider population. There's been vaccine skepticism, and up until now, the WHO has only had access to data on one, the Pfizer one. Why should South Africans themselves trust that vaccination is safe and effective?
Well, I think the first thing to note is that vaccines go through a process of testing. And they are essentially tested in the first instance for their safety, and then secondly for the efficacy. And in the clinical trials, and South Africa have contributed to 4 of the clinical trials globally, these vaccines have been shown to have an extremely good safety profile in terms of not causing any significant adverse events. Now, I think the point you have to remember is that vaccines are not 100% safe. So, for example, if even a child who gets a measles vaccine, there will be some pain, redness, and swelling at the site of the injection, and there will be some fever and maybe a bit of tiredness for the first 24 to 72 hours post-vaccination. That's a normal phenomenon because essentially what's happening with the vaccine is that you are being infected, if I could put it that way, with a very, very mild strain.
And I suppose that is the point then of discomfort, where we speak about the skepticism. Is it just largely due to the lack of data, or do people have legitimate fears given the great unknown about the disease? You say, yes, people are being infected, but this is only going to last for 2 days. But how do we know it's going to be 2 days? And they differ in terms of their safety and efficacy, the various vaccines. South Africans don't know yet which vaccine they'll be getting. And if a lot is unknown about how you're going to react to the vaccine, because not all individuals are the same. Is it justifiable?
Certainly it's justifiable. I mean, if you think back 20, 30 years ago, even in South Africa, we had major outbreaks of, for example, measles, literally killing thousands and thousands of children. And the only solution to that problem was to have a measles vaccine incorporated into our national immunization program. And that's been extremely successful. I mean, measles has virtually disappeared, and people tend to forget what that severe disease imposed on children's health and well-being. I think one of the big problems is the lack of information and the ignorance that people have with respect to vaccines. So one of the things that vaccine advocates, as well as the Department of Health, both at national and provincial level, is working on is a strategy to try to communicate with people at grassroots, highlighting, first of all, the importance of the vaccine in terms of reducing the severe disease and the death rate, as well as the safety of the vaccines, And I think that's important. People need to understand that vaccines are not new. They've been around, since smallpox, which was developed around about 1800.
And we know that there are people who also didn't vaccinate their children because of various beliefs, whether it be cultural or religious. What do you say to them? Why do you say that they should take a vaccine even if they deem it to go against their core beliefs?
So I think the principle behind people accessing vaccines, I mean, they have a constitutional right to accept or refuse. And we've had people who've refused vaccination in the past. I think the important point to note is that the more and more people that are vaccinated, the less there is spread of the COVID virus in the community. And that's why we're talking about getting at least 70% of the population immunized, because with that plus minus 70% group of people immunized, they will protect the other people as well, because you're reducing the spread of the virus in the community.
So let's talk about that herd immunity in simple terms. So if we're going to go from house to house, say in a family of 5, how many would you say is important to be vaccinated? And I'm not talking just a pure science, but just so that people understand that you may choose to not have it, but this is why it's important to protect the next person.
Yeah, so the vaccines are not currently recommended for children, all right, or for pregnant women, because the trials have not been done in children and pregnant women. So we're talking about the adults in the household, all right? So, or let's take a small community or a small village. The expectation is that we would expect at least 70% of people in that extended household or the extended community in the village or in the small town to be vaccinated to stop the spread of the disease in the community.
Thank you so much for taking the time to speak to us and sharing your insights. Professor Gregory Hussey of the Vaccines for Africa Initiative at the Institute of Diseases and Molecular Medicine at UCT.